Hello, ladies and gentlemen. My name is Dr. Hakim Chuan. I'm actually a dentist, a dental specialist. My specialty is orthodontics and implantology. I'm also an oral surgeon by training. Now, today I want to talk about a very interesting topic called Q10 coenzyme and vitamin C. Are they effective against gum disease? Now, the reason why I talk about this topic is because just yesterday I had one patient of mine who told me that he only need to take Q10 as well as vitamin C, and plus using a normal toothbrush, he can then effectively prevent gum disease. Right. So I feel that there's actually a need for me to discuss about this topic and evaluate the pros and cons of each of this, and then to see how we can actually effectively address this issue. Now, first of all, we talk about what is gum disease. Now, gum disease is actually caused by plaque accumulation. As you can see, very thick plaque and very sticky. Then you can also see that there is a swelling gum, redness, filled with inflammation, and you also can see that there's some bleeding. Then the bleeding deep inside, there's a deep pocket, and inside the pocket you actually have bone loss, and this bone loss actually causes the teeth to be loosened, and then after some time the patient's teeth will just automatically drop out.
Oh God, please, no! No!
So this is typical characteristics of gum disease. Now we evaluate what are the benefits of coenzyme Q10. Now Q10 is actually naturally produced by our body, but now has been made into many health supplements. The main advantage of Q10 is actually to enhance our immune system. Then it also regulate our blood pressure and protect our heart. And what are the effects of this against gum disease? Practically is indirect, not direct. Direct is none. So the indirect benefit, of course, is the immune system as well as regulate blood pressure. So now we talk about vitamin C. Vitamin C, as we know, is very effective against scurvy, and scurvy is actually due to bleeding gum. It causes bleeding gum, it causes dry skin, joint, muscle, and bone pain, and the patient feel very tired and easily get lung infection. So now it's been noticed a few hundred years ago on the sailor who sails in the sea for many months without vitamin C. So but nowadays this is a very rare condition, because in a modern society we have sufficient nutrients and very few patients actually come with a scurvy. So most of it actually presented with a serious periodontal disease, and vitamin C is only effective against scurvy but not against periodontal or gum disease. So what is important for us then is to remove the bacterial plaque. In a healthy plaque, you only have good bacteria, but as the plaque gets thicker and thicker, you have more and more bad bacteria. And finally, the plaque gets very thick, then you only have bad bacteria, you don't have good bacteria anymore. So all this bad bacteria is actually produce a lot of harmful toxin. For example, we name one actinomycetin comitants. They are actually gram-negative anaerobe. The way that they cause gum disease is by producing a lot of toxins, and this toxin will not only poison our gum tissue but also soften our bone, right? Make our bone easily penetrated by this bacteria and enter into our body system. Then the other type is what we call Treponema denticollis. This, as you see, the shape of it is like a snake. They swim very fast and they have very high penetrative power that will enable them to penetrate directly through the teeth, bone, and gum without any hindrance. So all these bacteria, if we don't remove them, they are very, very harmful to us. It causes very severe gum disease. Now, so what we then need to do is actually to use an ultrasonic medical graded toothbrush. And why I use the word medical graded is that there are many ultrasonic toothbrush available, but however, what you need to choose is one that actually has the sound frequency above 1 megahertz, because when it's above 1 megahertz you actually has the healing and therapeutic power. And what it does is that it increase the blood flow because it penetrate into the bone and the gum. It can actually increase the blood supply to our gum, and with the increased blood flow it means more oxygen, more nutrients to our body. And then it also helps in terms of lymphatic drainage. What lymphatic drainage does is that it drains our body fluid. It drains all the toxin and get rid of them quickly from our body as a drainage system. And then the ultrasound also helps to massage our gum and increase our gingival thickness and make them more solid and actually less of the looseness. Then last but not least, in fact the most important, it helps us to kill the bacteria and virus. It has been proven that when you have an ultrasound frequency of more than 1 megahertz, it is very lethal to the bacteria as well as virus. So therefore they can effectively kill the bacteria and the virus. So therefore we strongly recommend that you use an ultrasound, a medical graded toothbrush, in order to brush your teeth effectively. Now, ladies and gentlemen, I hope this YouTube presentation actually clears the doubt. And if you liked my presentation, I hope you can give me a like and share with many others. And then if you have any question, I welcome you to leave your comments in the comments tab. And thank you very much for your kind attention. Thank you.